In the 1950s, a discovery quietly began to shake the foundations of public health and change the way the world viewed a simple habit: smoking. For decades, tobacco had been woven into the fabric of society. Cigarettes were glamorous, featured in movies, advertised with doctors' endorsements, and considered a symbol of sophistication. People smoked in offices, in airplanes, even in classrooms. It was a habit largely unquestioned. Then the science began to speak. In laboratories and hospitals, researchers noticed a disturbing pattern. Cases of lung cancer, once rare, were rising sharply, and a link to tobacco use was becoming undeniable. Physicians and scientists meticulously collected data, comparing smokers with non-smokers, tracking habits and analyzing outcomes. By the early 1950s, two pivotal studies emerged from teams in the United States and the United Kingdom, publishing results that would forever change public perception. The findings were startling. Tobacco smoke contained chemicals that could cause mutations in cells, leading to the uncontrolled growth we now call cancer. The more a person smoked, the higher the risk. There was no safe level. The decades of marketing claiming cigarettes were harmless or even beneficial were finally contradicted by undeniable evidence. These studies were not just statistics, they were warnings written in human lives, in families grieving sudden illness, in patients coughing their lungs away. The tobacco industry did not take this news lightly. Powerful companies launched campaigns to cast doubt on the research, funding their own studies and advertisements to protect their profits. Doctors were shown in ads smoking with endorsements, and television programming continued to normalize the habit. Yet the scientific community was resolute. Peer-reviewed journals, medical conferences, and public health advocates amplified the message: smoking causes cancer. The momentum for change began quietly, then steadily. As the truth could no longer be ignored, governments began responding. In the United States, the Surgeon General commissioned research that would culminate in the landmark 1964 report officially declaring cigarettes a health hazard. Around the world, public health campaigns started to warn against smoking. Warning labels on packs, restrictions on advertising, and educational programs in schools slowly reshaped public perception. The seeds planted in the 1950s grew into a global movement to reduce tobacco use, improve awareness, and save millions of lives. Today, when we see anti-smoking campaigns, pictorial warnings, and regulations on tobacco products, we are witnessing the legacy of those first discoveries. Science spoke truth to power, and over time, culture followed. The work of those 1,950 seconds researchers was not just about identifying a chemical hazard. It was about challenging a societal norm, confronting an industry, and advocating for the health of generations to come. Their courage to reveal the unseen dangers of tobacco continues to resonate in hospitals, schools, and communities worldwide, reminding us that knowledge, once revealed, can transform society. The 1950s were the decade when smoking stopped being just a habit and became a public health concern. It was the decade when tobacco's invisible threat was finally exposed, a moment in world history where science began to protect humanity from a danger long ignored. History is not old. History is living inside us. One day, one event, one lesson. Mr. Feedy,